Hello to everyone. In this video we'll be giving a short description on the topic of the diagnostic studies in oncology, that is while diagnosing the pathologies of cancer, what diagnostic method we use. We'll be discussing that. Now in the modern methods of treatment, that is in surgery, radiation therapy and chemotherapy and biological therapy, leads to the cure for almost 2 out of 3 patients diagnosed with the cancer. So in the treatment of cancer, we use this diagnostic methods. In the case of surgery, or we are using any radiation therapy or chemotherapy, so in that case we use this. So in out of 3 patient out of that we use 2 patients to diagnose the cancer with these methods. So where does this diagnosis in oncology begins? So diagnosis begins with the survey of the patient and the collection of anamnesis. So diagnosis actually begins what are the symptoms of the patient, what is the history, what is the examination the doctor collects and examine, and further says the patient say to the patient to go to the lab diagnostic or instrumental diagnosis, whatever is needed for diagnosis of the cancer. Okay, now doctor asks the following information. First of all, the age of the patient, social status, where he or she lives, what is the locality, okay, and now he asks for any risk factor of the patient, particular type of cancer, or any the time of onset of symptoms, any symptom which is occurring, any comorbidities, or any type of medicine he or she is taking. So all this information the doctor asks first of all. Now after that the doctor examines your skin, your mammary glands and lymph nodes, because these are the areas which are more prone or which are the initiations of different cancers. Now in the case of lab diagnosis in oncology, we first of all do the blood analysis. This is the first factor, and generally doctor will notice and decrease a number of formed element, that is leukocytes, platelets and RBCs. So these are the samples which the doctor used to collect, that is the through the blood the doctor used to watch this formed elements in the blood, it is normal or not, in the case of a lab diagnosis of oncology. And we use some tumor markers for specific type of cancer, as alpha fetoprotein for liver cancer is in liver, we check this type of protein or tumor marker, total PSA and free PSA for prostate, CEA for intestine, CA 19.9 for intestine and pancreas, CA 72-4 for stomach, CA 125 for ovarian cancer, CA 27 to 29 for breast cancer. So these are the tumor markers we use for different types of cancers. Now tumor markers are not sensitive enough to determine, so by tumor markers we cannot confirm the diagnosis of any cancer or rule out any cancer. Like example, CA 125 can be found in pelvic inflammatory disease also. Okay, so CA 125 is for ovarian cancer, but it can be also found in the case of any type of pelvic inflammatory disease. So the tumor markers are not confirming not enough to determine any type of or confirm the diagnosis of cancer. Now for that further we use the imaging methods. Now first imaging methods we have is ultrasound examination. So ultrasound examination that uses high frequency of sound and waves to produce images of human body structures. Okay, so that is called as transesophageal and transvaginal. So these are the ultrasound which are done through the esophagus or vagina, and this method is safest for the human body and no contraindication indication is there, and used to diagnose actually the cancers of uterus and pancreas. Okay, now CT scan. Now X-ray images taken from patient at different angle is actually called as CT scan. So it is the most advanced type of X-ray. Like X-ray is normal, and if we go for at different angles we take the X-ray images, that is called as CT scan, and it is used during the emergency of the patient and in the emergency medical care. We have to initiate or very fast we have to do the diagnosis of any pathology, emergency patients. In that we use CT scan is preferred. It is planned medical, surgical and radiation treatment, and it does not harm the patient. Now third we have the MRI, magnetic resonance imaging. MRI does not use X-ray, any type of X-ray is not used, and is used to examine the soft tissues. Actually soft tissues are examined through this, like central and peripheral nervous system, muscles, ligaments and tendons. And in oncology, MRI is used to diagnose specifically the brain cancers. Now during MRI or CT, injection of contrast agent is through 3 main ways, like through mouth you give for transesophageal, Okay, for that, for those area we use the contrast agent through mouth, and through vein we use for like any abdomen or abdomen area or muscles area. For that we use vein to insert the contrast agent in ovary or pelvic area, and with the help of enema we actually diagnose the area of the abdomen like stomach cancer or any pancreatic cancer. So we use that way to insert the contrast agent, which will be used in the case of MRI and CT. Okay, so now I have some images, you can see it here. I have some images. Okay, so now you can see this is a transvaginal ultrasound. Okay, you can see this is your vagina, and this is the ultrasound inducer, transducer, and this is sound waves, and this will be showing your image of the vagina. Is there any cancer? So this is done through this way. Okay, now we have this image. This is a CT scan of your lungs, and you can just blue one, you can see this is your lung cancer. Okay, so this is the image of your CT scan, okay, from different angles, cross section. And this is your MRI. As I told you, MRI is done from specifically for the brain tumor. So in this image you can see this is actually a brain tumor which is visible in the MRI, magnetic resonance imaging. Okay, so this much is clear. Now we have to move on to this another method that is called as PET scan. So PET scan is positron emission tomography. Now it is used to identify actually the metabolic exchange, not any soft tissues or not any bone or anything. It is used only for metabolic exchange. Now functioning of the changes which are occurring in the organs and tissues. Okay, so PET scan uses radioactive drug to diagnose, and it is also inserted, this radioactive drug is inserted contrast agent like MRI and CT. In case of cancer, it is injected in vein and accumulates in various parts of the body, and for detecting any malignant cells shows higher metabolic activity than normal cells. So when we insert this contrast through vein in the patient's body, it accumulates, and if there is any cancer, it will have higher metabolic activity from normal cells. So if the area, any area where is higher metabolic activity, that area is accumulation of malignant cells. And how we can find like show bright spots on the PET scan. So the malignant area will be showing bright color spots on the PET scan. So that will be differentiating the malignant cells from the normal cells, and this method is combined with CT or MRI. So in this image you can see the PET scan. So this is actually your ovary. Okay, so this is actually the female pelvis. So this is the ovary which is enlarged, and this bright area you can see, what as I told you, it will be higher metabolic activity will be seen, and on the PET scan it will be bright image. So this area is actually your ovarian cancer. Okay, so this was the PET scan. Now we have endoscopic methods. Endoscopic methods allow a doctor to look inside the patient body using an endoscope. Endoscope is a machine which is allowed to put on the patient's body, and which displays the image on the TV of that organ. So you can see the real organ on the TV. Which we do arthroscopy, we do for joint. The term we used, bronchoscopy for lungs, bronchi, colonoscopy for colon, that is large intestine, sigmoidoscopy for sigmoid colon, ureteroscopy for ureter and urinary system, laparoscopy for full abdominal cavity, and fibrogastroduodenoscopy for esophageal and stomach. Now you can see this in this diagram. This is esophagogastroduodenoscopy, in which upper endoscopy is done, and this fiber is inserted and light is done, and which shows the interior of the stomach. Okay, okay, this you can see the interior of the stomach. This is your stomach line, and after inserting this tube in endoscope, the image is produced on the TV. So TV is present near the outside the beside the patient, the TV. Then doctor sees there, if there is any pathologies, he or she diagnoses it. Now we have the biopsy. So biopsy is nothing, it is just is carried out after the probable tumor is established. When we have diagnosed the tumor, then we used to examine to identify or say what is the quality of the tumor by examining the tissue, taking the part of the tissue. So we identified the tumor for growth, how much it has a growth, or how much degree of cellular atavism is there, the characteristics of cancer cells, and how much invasiveness the cancer is. So invasiveness meaning how far the cancer can spread, metastasis. Okay, so this selection of therapy and predicting the cause of cancer, we use the biopsy. Okay, so biopsy is done for that. You can see this image biopsy image, bone biopsy is done. So this is a needle is pressed, okay, and some tissues are removed out, bone tissues, and they are further examined in the microscope. So this is the bone biopsy, closed bone biopsy which is done. So this was the diagnostic methods. Thank you.